Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about humerus fractures and sort of the prevalence of them and how these occur and the rehab process when fractures are humerus. So firstly, when a fracture occurs in the humerus, usually there's some form of specific trauma. So it'll either be something where it's impacted in some way, so for example in like a car accident, some form of very, very hard impact directly on the shoulder, or a fall of some type. So something called a fouche injury, right, where somebody actually falls on an outstretched arm, or sometimes even if they fall kind of on the elbow area. And so again, what'll happen is there'll be a fracture, so the bone will break essentially in the humerus. And now depending on where the break occurs and what type of break it is, will influence the rehab of a humeral fracture. So for example, if the fracture is displaced versus non-displaced, so a displaced fracture basically means that the bones are apart. Now when that takes place, typically in a lot of cases there'll need to be perhaps a pin and a plate put in or something to set it correctly. In a non-displaced fracture, it's basically, you think of it like a crack in the bone, but the bone, they're still in the same general, there's still a general connection, so to speak, versus when the bones are, like I said, completely apart. Typically in a non-displaced fracture, the healing time might be a bit longer than a non-displaced. Usually you're looking at, or with a non-displaced, around a, let's say 6 to 8 week healing time in terms of the bone. And then from there, like I said, we'd go into physio rehab. With a non-displaced, some patients, essentially they'll just be in a sling for a certain period of time, typically less than those 6 weeks, and then they're allowed to not necessarily have a sling in, but typically they need to avoid any sort of lifting or contraction of the muscles around the humerus in order to prevent, or in order to allow that healing to completely occur. So in a lot of cases with a non-displaced, like I said, we might start doing some very, very gentle early non-active range of motion for part of the rehab. So let's assume now that, again, the bone has fully healed, the patient has had an x-ray, and everything essentially has healed within the bone. Then at that point, we would start our rehab. Now, typically after a humeral fracture, the joint, the shoulder joint, will be really, really stiff. So a patient might not be able to, especially actively, move into their full range of motion in the shoulder. So that's a big component, is to start to regain and perhaps do some gentle mobilization or gentle passive range of motion of the shoulder joint to start regaining the range of motion. The other thing too that tends to happen is there'll be certain muscles that'll get really, really tight as a result of being either in a sling, or for some there's a brace or cast that's worn. So upper traps in a lot of cases, pecs will be really tight, biceps will be really, really tight, and also in a lot of cases there'll be some stiffness around the scapula of the shoulder blade, again as a result of being in this sort of forward or rounded shoulder position. From there, again, as a result of disuse, the rotator cuff muscles that surround the head of the humerus will be quite weak. And so again, as the mobility improves from there, we'd actually want to start moving into some form of strengthening, typically some form of isometrics initially, and then working to resistance with movement, and then from there actually making it more functional. Now, a couple other things to keep in mind with a humeral fracture is, depending on where the fracture has taken place, for some, if it's a higher fracture, so actually right on the humeral head, sometimes that can also influence the rehab process based on if it's close to an attachment point for some of these rotator cuff muscles. Tends to make it a little bit harder in terms of improving the strength quickly. So again, these are all sort of factors that can take place in terms of how the recovery of this injury occurs. Please make sure to check with a physiotherapist to make sure that this information is appropriate for you. And if you like the video, please hit subscribe below. And thanks again for watching. I really appreciate it. Have a great day. Take care.